My grandparents, as they aged, accepted losing teeth, ultimately getting dentures. I will not be so accepting of that. And thanks to the doctors we are talking to next, we don't have to. Joining me are Dr. Victor Saunders and Dr. Stephen Saunders of the Shenandoah Valley Implant Institute. Thank you very much, Dr. Steve and Dr. Vic, for joining us. We're going to talk about two things that you specialize in today. The first is if a patient has advanced gum disease, periodontal disease, you guys do a procedure with a laser that requires no cutting, little downtime. Tell me about what a patient can experience with that.
Well, the procedure is called LANAP. It's a laser-assisted new attachment procedure. And I've been treating patients for 30 plus years as far as periodontal disease. Most of the procedures were resective in nature up until the advent of this laser, meaning that we just had to retreat and set up forces at a lower point. Many times the procedures were rather painful and we were losing ground. This laser adds a technique that we can no cut, no sew, little downtime if any, and we actually are regenerating bone rather than resecting tissue. So it adds a great positive aspect to treatment of gum disease.
And Dr. Vic, when a patient comes in, how advanced can their periodontal disease be and this laser technology work for them?
We're now succeeding in cases that previously we would have given a hopeless prognosis to. And one case in particular recently, the bone was completely gone beyond the end of the tooth, and we were able to regenerate the bone halfway up. And so we're succeeding now with this technique in cases where we couldn't before.
That's really amazing. And there's really like no pain associated with it?
Very little discomfort, no pain. You can get up and go on about your normal daily routine, carry on with your normal daily routine.
How many treatments are required?
Usually 2 treatments. One half of the mouth is done the first appointment and the other half the second appointment.
And over what period of time does the mouth and gums return to full health? How long does it take after the laser procedure?
Healing continues to go forth in the regenerative process for up to a year, and a real regular cleaning schedule is critical. But as far as what the patient feels and when they feel back to normal within a couple of days.
That's amazing. So the next thing that certainly you are known for, you are the Implant Institute. If a patient has lost teeth due to gum disease or injury, you guys can replace those teeth. Tell us about the implant process.
Well, the implant process is very straightforward. Again, we've been doing that for a good many years. Let's take somebody, for example, that has a sports injury, a young person that has a broken incisor right up front. Mm-hmm. Well, that's an awful, embarrassing situation for that individual and can be painful. And with the technology that we have available today, we can actually have that patient come in to the office. We can extract the remaining root from the socket, replace it with an implant, and have a tooth made for that replaces it within a couple of hours. So, I mean, it's basically in and out, and rather than have a gap up front, they can have a tooth replaced. Now, that's a simple process as far as a single tooth, but with patients with dentures or partial dentures where they're flopping around or their diet's not what it should be, in those complex cases, we've added technology that allows us to do guided surgery. And so with this CAT scan technology, we can actually have someone come in and put 4 to 6 implants in an upper arch, say, and then have teeth put on that same day that replaces the missing teeth.
And are these permanent implants that you're putting in at that point, or do they come back and get a permanent implant?
No, these are permanent implants. The teeth that go on immediately are a temporary situation. They last for about 3 months, or they'll actually last longer, but we like to replace it with a permanent fixture within a 3-month period of time.
Well, and you guys must do a great job, because we would actually like to hear from now some of the patients that you've been able to help.
I was referred to the Shenandoah Valley Implant Institute by my dentist. I will admit, when I began looking into dental implants, I had my reservations. I had virtually no pain at all. Now that I went through and had it done, I've been very satisfied with the doctors, the staff, and the service that I received. at the Shenandoah Valley Implant Institute.
I was in here about 6 months ago and had 8 implants at one time, about an hour and a half. And I went back to church.
When you have a bad tooth, you can't get away from the pain. After you've dealt with just about every procedure there is out there, just to have the pain go away is a wonderful thing. When he put the implant in, it was like I never lost a tooth at all, and have been doing implants longer than anybody in the state of Virginia. So if you need an implant, this is where you need to be.
And Dr. Vick, as we close out, why don't you hit the major health things and overall health that your work can impact?
Beyond just restoring teeth or replacing them and the obvious effect that has on the intake of nutrition, there's also the interaction with systemic factors such as cardiovascular disease, as well as control of diabetes, number and incidence of respiratory infections, among others, but these are some of the more important issues that are impacted.
So the overall health of your teeth and your mouth are a big, big deal.
Exactly.
Thank you so much, doctors.